What percentage of people are dying from coronavirus? The U.S. death toll is still approaching 130,000. Many states are seeing record numbers of new cases and hospitalizations. I spoke with Dr. Lisa Larkin, founder and CEO of Ms. Medicine, about what's happening here and her message to all of us. Dr. Larkin, good morning. Good to see you.
Good morning, Sheila.
When you hear that the coronavirus numbers are going up in at least 40 states now, does that alarm you?
It sure does, Sheila. And on a national level, it alarms me. And then really in our local community, it certainly alarms me. And actually what I saw in the office yesterday, validates the fact that the numbers are real and they're going up.
So what are you seeing at your office, at your medical practice?
Well, so yesterday I had more positive tests and more families and clusters of people that are positive than I've had in all the prior months of COVID. So it was really a very significant day in my office yesterday.
Is there anything they had in common? Have they been to any particular gatherings? Are they not wearing masks? Anything like that?
So no, interestingly, all of the people had really tell me that they had been social distancing and actually wearing masks. It was two families that really don't have any clear exposure. 3 members of one family, 5 members of another family, and then a physician who was also positive yesterday. And so again, clusters, people don't know where they're getting exposed, but clearly summertime, is not really having a huge impact on the spread of the virus.
Yeah, big reasons for concern. Do you think, like some do, that states need to start mandating mask wearing?
So I actually do, and I know that this is a very difficult and polarizing discussion. I'm not really sure why. The numbers are going up as we've relaxed social distancing. That's the timing of when the numbers have gone up. We know that masks work. I don't love them either, but the truth is the numbers are really going up, and that's if we don't want to shut down everything again, a mandated policy would just make it easier for everyone to know what they should be doing, where they should be doing it, and to do it consistently. Because I really believe that if we don't want to have a very significant continued increase, we all need to do our part. And although it's not great, we should be wearing masks.
Yeah, one thing I want to highlight too, because I haven't seen it in a lot of places in the media, and that's pointing out that if a lower percentage of patients who get COVID are dying from it. Is that because some people are listening, or is it because doctors are better able to deal with it? What do you give the credit to?
So I don't really know for sure. I can tell you testing is more widely available. And certainly in my practice, I'm able to test now. So what I'm seeing is people with more mild infections are getting a positive test. And so we're seeing those people, right? So I'm seeing them in my office. I know that they're positive. These are not the people that are ending up in the emergency room and very ill. Clearly, the numbers are going up in the hospitals, though, as well. So as numbers are rising, this is not all a phenomenon of just increased testing, because there's more patients in the hospitals, there's more patients in the ICU. So we are seeing that as well. I just think we're identifying more of those asymptomatic or very mild infections now, because testing is more available.
Yeah, that's interesting. And finally, what else do you want people to know, whether they're planning a trip or going to the park or thinking about, how to send their kids back to school in a month? What do you want people to know?
Right. I mean, again, it goes back to wearing a mask when you're certainly indoors with groups. Everyone should be wearing a mask. And hand washing is so critical. Continue to try to be vigilant, because although we all would love to be forgetting about COVID and back to our normal routine, that is just not what's happening right now. And we really do need to protect those that are the most vulnerable. So certainly if you're, having a gathering and there's older individuals there, you need to do everything you can. And that includes wearing a mask to protect them.
Dr. Lisa Larkin, thanks so much for your expertise this morning.
Thanks for always having me, Sheila.